Hello, my name is Nicholas Rosas. Hello, my name is Nicholas Rosas. This is my presentation for human physiology on cocaine addiction. Uh, it's for cohort 13, Dr. Khalifa. I just want to start off with the outline. We're going to start with our introduction, move to the anatomy of cocaine addiction, the physiology of normally how the body works, and we'll move into pathophysiology about how cocaine affects the body, how it's diagnosed, how it's treated, how it interacts with AI, and then some demographics and facts. So, for my introduction on cocaine addiction, as stated here, is a chronic a state of stress characterized by uncontrollable and compulsive behavior. The patient will seek cocaine despite the negative consequences associated with it. It's illegal. Um, you can see these characteristics on them. There's weight loss, pale skin, dilated pupils, unexplained nosebleeds, and then sometimes track marks. Some facts about cocaine is derived from the coca leaf. Uh, it's a white powdery substance that can be snorted or injected, and it's a Schedule II drug, and it's illegal in the United States. So, as for its anatomy, the immediate effects of cocaine are a feeling of euphoria. You get energy, restlessness, agitation, um, a feeling of being able to do anything, uh, talkative, more alert, more aware. Pupils become dilated. Um, then also unnoticed effects are your hypertension, your tachycardia, your blood pressure is going to shoot up, your heart rate's going to go up, and I'll explain why that is later. Um, Negative things can be tremors. Extreme symptoms could be seizures and heart attack. It's very rare, but it is possible. The long-term effects of cocaine um, affect the body's organs, almost all of them, really, and honestly, the most important ones. Long-term effects of cocaine affect the heart worst of all. So it causes vasoconstriction, and that's what primarily leads to heart attacks. Because the constriction causes your blood pressure to go up, and then your heart's trying to beat as fast as it can to keep up. That leads to arrhythmias and then cardiomyopathy, which leads to, that necrosis of the heart, which causes a heart attack, basically. You can see here on the lungs, smoking cocaine. Oh yeah, also cocaine can be smoked as well as injected or snorted. So when you smoke cocaine, it results in pulmonary edema. So that's, swelling inside of your lungs. That can result in pneumonia or respiratory distress. It can lead to another long list of complications after you have pneumonia. Repeated pneumonia is not very good for you. You can acquire scar tissue in your lungs, which make it harder to breathe. Kidneys. Your blood flow gets reduced. Acute kidney issues can happen. Chronic kidney damage, tissue damage. Like I was saying, scar tissue damage, where that'll provide lifelong issues where your blood pressure isn't where it should be because of the scar tissue that doesn't allow your kidneys to function how they should. Also, the liver. The liver has to break down all the toxins in the cocaine and whatever it's being produced with, whatever it's cut with. I mean, it's illegal, so the people who use it aren't sure where they're getting it from, what the source is, what you're having to break down. So it's terrible for your liver. And again, the brain. It increases your risk for strokes, seizures, and long-term neurological damage. And that in of itself is terrible, but you'll see that in long-term cocaine use where paranoia sets in and there's a lot more side effects that we have to deal with in terms of the brain. So cocaine works on dopamine. Dopamine is a neurotransmitter responsible for feelings of pleasure, motivation, satisfaction. It's the reward center, right? Or the reward neurotransmitter. Um, the way it works is that your body is producing dopamine, whether you're exercising, whether you're perceiving it as a reward. Dopamine transporters, once the dopamine has been released, will remove the dopamine molecules from the synaptic cleft. And so that way, you're not overexposed to dopamine because that could come with its own negative side effects. This process is called dopamine reuptake, and this occurs when dopamine is transmitted back into this presynaptic neuron that initially released it after it was released in the synapse. So once it's been a sensation releases it, it does its job, stays in the synaptic cleft. The dopamine transporters grab it, take it back to the synapse which released it, and then it's waits to be released again. This is how our bodies regulate our dopamine levels. This is how we normally function. This process takes place in the prefrontal cortex. Dopamine receptors can regulate after overuse, so you can use them, but they need to resettle. Um, and then the body maintains the levels needed for whatever interaction you're in or activity you're in. Um, it's released by the hypothalamus, and some effects of it is it relaxes blood vessels, increases sodium, reduces insulin production, and provides a good feeling or a euphoric feeling, and also it motivates you. It's responsible for your motivation. So this is the chemical equation for cocaine. Cocaine works by binding and blocking dopamine transporters. Those transporters I was talking about that are responsible for taking the dopamine back to the original synapse. What they do is the cocaine molecules will bind to dopamine receptors and or transporters, I'm sorry. So that dopamine is essentially trapped inside the synaptic cleft and it's just in there. And you're getting a constant feeling of euphoria, constant feeling of upness, happiness. So when your dopamine should be taken away, basically it's not being taken away, it's staying. This is called dopamine reuptake inhibition. This is what cocaine does. Uh, so cocaine concentrates in the rewards pathway and affects the part of the brain responsible for voluntary movement. So that's why you're constantly seeing people fidget, move around, high energy, bouncing around, talking, chattering, clenching their jaw. The cocaine is uh, stimulating the brain's part of the brain, sorry, that is in control of voluntary movement. So you're going to want to move, you're going to want to go around. Um, this overexposure to dopamine causes the euphoria, like I talked about before. So the happiness, that up feeling, that invincible feeling that people talk about. Other signs include dilated pupils, like I said before, the hypertension, the tachycardia, vasoconstriction. The reason this happens is that cocaine blocks norepinephrine transporters as well as dopamine transporters, so it kind of keeps your blood pressure up. All the effects of epinephrine keep going. So to diagnose cocaine addiction is very difficult. It's a disease where basically you have to admit as the person who's addicted that you are addicted. Without that admittance, most people don't even know you're addicted. Most people don't know there's an issue. Most people aren't even aware that you need help. So it's kept hidden. But there are signs that you can see physically in a person. Like I said, bags under their eyes, they look tired, they're not sleeping, they're losing weight, they're getting thin. You can notice it if they're financial issues, out of money when they shouldn't be, say they have a good job, but they're disheveled, they're asking you to borrow money. Um, and then later on, as the abuse continues, you'll see emotional outbursts. Sometimes they'll steal from you, theft, lying, physical threats. Desperation comes into play when they can't get their addiction in or what they need. It starts to affect them. And the longer cocaine abuse is abused, the more apparent it is. So it's not as though these things come out of nowhere or there's no idea. There are signs. You just have to be able to see them. But like I said, if the person isn't willing to step forward and say, hey, I have the problem, then more than likely it won't show up unless they get busted by a drug test or arrested, which is usually what happens. So, treatment. Like I said before, once the addiction has been acknowledged and admitted to, treatment can begin. So, there's no medications really that just stop your cocaine addiction. Once your body has become dependent upon it, it's physically dependent upon it. Um, what that means is that without cocaine, your body will begin to go through withdrawal signs and symptoms, similar to opioid addiction, to where the body needs it to function. The only way to go through it is to stop taking, stop using it and to kind of ride out the withdrawals. So the only thing that can be done is really to treat the symptoms, to treat the withdrawals. And that comes with nausea. So basically, the opposite of everything the drug caused is what will happen when you withdraw. So for a drug like this, an amphetamine, you're going to be sleeping a lot. You're probably going to not be able to eat. Low energy, not be able to move around, do much. You're going to feel terrible. Um, so the only way to really safely stop cocaine addiction or cocaine use is to enroll in a medically monitored detox facility. Once you do that, you can be monitored by staff who will administer medication to treat those symptoms. And from there, you can go on to recovery. But the sad part is most addicts relapse and begin the process again, or they overdose, or they die, or they go to jail. All of the outcomes are negative. So for AI and cocaine, I wasn't able to find any real link between the two. Um, AI can help compute statistics and things like that, but in terms of treatment or diagnosis, there's not much that AI can do. Um, so for demographics, adults between 18 and 25 are the highest risk for cocaine addiction. If you think about it, it makes sense. That's when they're starting to go out. At 18, you finish high school, you're starting to party, start college. By the time you're 21, you're starting to drink, you're at the bars. That's where this drug is seen at a lot of the time. So the US and England had the list of most cocaine users per nation. That would make sense. A lot more education colleges, a lot more upper class societies. Cocaine is considered the rich man's drugs, quite expensive, so that would make more sense. Over 1 in 5 overdose deaths are linked to cocaine, so that's quite a high number. I think under opioids you have cocaine, which is really popular as one of the leading causes of overdoses, which is treated completely. There's no Narcan for cocaine. Um, they're gonna have to try and get your blood pressure down, your heart rate lower. What's usually the result of a overdose from cocaine is a heart attack or a stroke, and that usually leads to death. 70% of the world's cocaine supply comes from Colombia, all one place. You think that would help to solve the problem, get rid of it at the source, but it hasn't. It's still prevalent, still causing addiction, still an issue that needs to be addressed. Baby boomers were found the generation most likely to do cocaine. So hopefully, as time goes on, it will be less, and we'll see less and less of this drug being used to really destroy lives and ruin people's futures. That is my presentation on cocaine addiction. Thank you very much.